Hi there, this is Mark Lagon, and I'm Chief Policy Officer at Friends of the Global Fight. We're really happy you're with us today. We're very focused on one part of the larger picture of global health, the work to fight AIDS, tuberculosis, and malaria, and a particularly dynamic and nimble partnership, the Global Fund, to fight those three diseases. I'm delighted that my colleagues here have put together, I think, what's a great basic training on advocacy, how to think about getting across ideas on global health, and specifically about things like these three devastating diseases. We're looking forward to working with you over time, this not just being a one-off, but maybe we can work together as time goes on to push for these three diseases, AIDS, TB, and malaria, to move towards a stage where you don't think of them as epidemics, and looking how it fits into the bigger picture. We are quite concerned about the budget atmosphere in Washington and being able to go forward on global health and generously fund them. And we'd love your help effectively advocating for good policy and resources for that. Anyway, so I'm going to turn things over to True Claycomb, who's policy manager at Friends of the Global Fight.
Hi, everyone. Thank you so much for joining, and thank you for your patience with our technical difficulties. I just wanted to remind everyone to mute their microphone, because I'm getting some feedback right now. So again, if everyone can mute their microphone, that would be really awesome. Okay, so I guess we will just begin. Again, please mute your microphone. I don't know, I can't see whose microphone isn't unmuted, but I can hear someone. So I'll just go ahead and begin, and again, please mute your microphone. So let's get started. Thank you so much for joining us for the Friends Advocacy Training for the Global Health Corps Fellow and Alumni. I'll begin with the agenda, which just goes over what we're going to be discussing over the next hour. So first up, we're going to talk about the budget, and then the appropriations process, and then global health financing, as well as proposed cuts within this administration. Part two is going to be how to advocate and messaging around global health funding. So let's begin with breaking it down a little bit. The budget and appropriations process is honestly really confusing, and so our hope is to make it really easy for you all to understand. The budget and appropriations process is expected to follow a rigid calendar and a series of procedures, but those deadlines and the procedures are rarely followed. A small number of key concepts are important to understanding the federal funding process. In the largest sense, the government funds a substantial and diverse range of programs and activities, from global health programs to Social Security to military operations. The majority of federal spending consists of mandatory spending, sometimes called entitlements. Our nation's three largest entitlement programs, Social Security, Medicare, and Medicaid, are mandatory funded programs. The government allocates funds to all who are eligible, regardless of the annual cost to the Treasury. Mandatory spending is generally governed by statutory criteria. It is not normally set by annual appropriations acts. The other category of funding is known as discretionary spending. All federal funding that reaches international development and global health programs is part of this discretionary spending. The authority for discretionary spending stems from Annual Appropriations Act, which are under the control of the House and Senate Appropriations Committees. So the budget and appropriations process is an annual event, Congress is tasked with producing a budget resolution and 12 appropriations bills for each federal fiscal year, which begins on October 1st and runs through September 30th. The president's budget request starts the process, and then Congress responds. The president's budget request details the administration's position on a full range of federal revenue and spending. It is important to remember that the president's budget proposal is simply a request. It has no binding authority on Congress and is best understood as a detailed statement by the administration of its goals and policy preferences. The first step in the funding process is the creation of a concurrent congressional budget resolution. The budget resolution sets the total level of discretionary funding, known as the 302A allocation, for the following fiscal year. Budget resolutions are supposed to be filed by April 15th, although this has rarely been the case in recent years. With the 302A allocations determined, the funding process moves to the appropriations committees in each chamber. Appropriations is responsible for determining program by program funding levels. This is done through 12 separate appropriations bills, each generated by a specific subcommittee covering individual federal agencies or groupings of agencies. The chairs of the appropriations subcommittees, under the directions of the appropriations committee chairman on both the House and the Senate, divide the 302A allocation among 12 subcommittees. This allocation provides the total funding pool for each of the appropriations bills, known as the 302B allocation. So basically, the 302A allocation represents the size of the whole funding pie, while the 302B allocation is equivalent to the size of one of the 12 slices of that pie. For example, the bill that covers global health programs is the State Foreign Operations and Related Programs Appropriations Bill, and it covers the United States Agency for International Development and the State Department, as well as a handful of multilateral funding streams like the Global Fund and Gavi. So this is the federal budget process in a normal year. This is what is normally supposed to happen, but it has rarely happened in the past couple of years. The president releases his budget for the following year in February, with the budget committees following up with their draft of the budget resolution, and the appropriations committees beginning their hearings in March or April. The appropriations committees then begin to draft their spending bills for their particular jurisdiction, and then later in May to July, the House will begin passing their appropriations bills for federal programs. These bills are then sent over to the Senate for consideration. The Senate will then amend the House spending bill through the appropriate subcommittees. The House and the Senate will then negotiate the differences in the bills and sign a final appropriations bill package by September 30th. If they can't agree on a full funding bill for the following year, they will pass a continuing resolution, which usually funds the government for a predetermined limited amount of time, generally with the previous year's spending levels. This timeline hasn't occurred in many years, and we've been living on these continuing resolutions in the past few years. Additionally, with the new administration, the timeline is slightly different. For example, the president's full budget proposal will not be coming out until next week, May 23rd, 2017, thus delaying this entire process. So now that you know a little bit about how the budget process works, let's look at the federal budget. The international affairs budget makes up a small percentage of the entire federal budget, only at 1.4%. In a Kaiser Family Foundation study in 2015, the average respondent thought that 26% of the federal budget went to foreign aid, more than that of Social Security or Medicare. Unsurprisingly, more than half of those respondents thought the United States was spending too much on foreign aid. We must educate Americans that the international affairs budget is only 1% and make the case that this small percentage has multiple benefits that could have positive impacts for spending in other categories. So So within the international affairs budget, global health makes up about 25% of the international affairs budget and 0.25% of the entire federal budget. The total international affairs budget is roughly $60 billion. It was in FY 2016 and it is in FY 2017. While global health makes up 0.25% of the entire budget, the Global Fund makes up 1,000% of the entire federal budget at $1.35 billion. So, global health financing. Why does all this budget process, cuts, etc. matter? The United States is the wealthiest nation in the world, and with only 0.25% of the entire federal budget going to global health programs, we need to really ensure that Americans know how important this small percentage is in the grander scheme. Knowing the history and the facts about global health financing during advocacy is very important. While very little of our budget goes to foreign aid, understanding what proportion of this budget goes to particular global health programs is very important. This is the U.S. global health budget in 2016. As you can see, HIV/AIDS is a very large piece of the pie at 51%. HIV and AIDS have historically been funded higher than other global health programs. This is largely due to the HIV/AIDS epidemic impacting millions of Americans in the mid-1980s and 1990s. AIDS activists changed the course of the epidemic, calling for more funding both in the U.S. and globally. In tandem, the President's Emergency Plan for AIDS Relief and the Global Fund to fight AIDS, tuberculosis, and malaria were started in 2003 to tackle the HIV/AIDS epidemic globally. PEPFAR was started shortly after the Global Fund under President Bush, and the funding has largely been maintained, and both programs have historically had strong bipartisan support in Congress. PEPFAR and the Global Fund make up the majority of HIV/AIDS funding. In this fiscal environment, our advocacy efforts to maintain this level of funding, both in global health programs and the entire international affairs budget, is really crucial. So this is a graph of the U.S. funding for the Global Fund from 2001 to 2017. And before we talk about maintaining the level for the Global Fund, let me explain a little bit about what the Global Fund is. It's a 21st century public-private partnership organized to accelerate the end of AIDS, tuberculosis, and malaria epidemics. It's a financing institution. It provides support to countries in response to the three diseases. It does not implement programs on the ground, but it supports programs run by local experts in countries and communities most in need. The Global Fund raises and invests nearly $4 billion a year in the three diseases globally. Global Fund financing comes primarily from the public sector, with approximately 95% of the total funding coming from donor governments and the remaining 5% coming from the private sector, private foundations, and innovative financing mechanisms. The U.S. is a leader in the Global Fund, leveraging financing from other donors by requiring a 2/3 match from other donors worldwide. For every $1 the United States invests in the Global Fund, other countries and private sector partners must invest $2 more. The Global Fund raises financing in multi-year cycles known as replenishments. The fifth replenishment this past September solicited funding for the 3-year period from 2017 to 2019 and mobilized $12.9 billion for the next 3 years. The United States government committed up to $4.3 billion to the Global Fund through 2019. In order to fulfill this $4.3 billion, the U.S. must continue funding the Global Fund at $1.35 billion in the federal budget over the next 3 years. As you can see, funding has flatlined since 2015. We are still only asking to maintain level funding for FY18. The Global Fund has saved more than 20 million lives since 2002. As of July 2016, the Global Fund had disbursed $30 billion to support programs for HIV, TB, and malaria. There have been 1/3 fewer deaths from AIDS, tuberculosis, and malaria in countries where the Global Fund invests. So to stress the importance of the U.S. investing in global health and knowing health funding is only 0.25% of the entire federal budget, the U.S. has historically been a strong leader in global health. From 2000 to 2014, the U.S. provided more than $122.6 billion to global health programs. In 2016 alone, shown here in the graph, you can see that the U.S. contributed $12.8 billion of all global health funding in 2016, making up 33.96% of all global health funding. As you can see here, global health financing increased from 2000 to 2015. This corresponded with the launch of the Millennium Development Goals, which catalyzed and aligned many sources of funding to target 4 health areas: HIV/AIDS, malaria, tuberculosis, and maternal, newborn, and child health. Additionally, as we already discussed, the Gates Foundation, the Global Fund, and activity in the global AIDS advocacy movement spurred global health efforts along in these critical areas. The galvanizing effort has corresponded with exceptional advances. Due to this funding increase from 1990 to 2016, maternal mortality has fallen by almost 50% since 1990. New HIV infections fell 38% from 2001 to 2013, and among children, new HIV infections declined by 58%. For malaria, the global malaria mortality rate fell by 58% between 2000 and 2015. The tuberculosis mortality rate fell by 45% between 1990 and 2013. These increases in global health financing are working, and they are saving lives and making a difference. This next figure illustrates an alternate scenario to the flat line trend in global health financing since 2010. The red line represents the global health financing total that would have been observed had the growth rate from 2000 to 2010 continued through 2016. If that trajectory had been realized, an additional $82 billion would have been distributed to low and middle income countries from 2000 to 2016. But because funding has remained flat since 2010, we must continue to advocate for funding for global health. Our advocacy is focused on the U.S. being a historical leader in global health and why we must continue to invest. We'll delve further into messaging after this section. So now that we know a little bit about the budget, appropriations, and the history of global health financing, as well as why the United States investments in global health are crucial, let's talk about what's going on now. President Trump's budget proposal, or the skinny budget, for fiscal year 2018, which is next year, came out on March 13th, and the Office of Management and Budget Director, Mick Mulvaney, stated that this is a hard power, not a soft power budget. This means that much of the international affairs budget's programs will be cut in order to make room for more spending on defense. While the full budget will come out next week, the skinny budget gave us some insight into what would be cut. The skinny budget proposal cut 31% to the State Department and USAID, as well as the Department of Health and Human Services, including the National Institutes of Health. If enacted, these cuts would have significant impact on programs that advance global health innovation and protect the world and Americans from global disease threats. The skinny budget calls for nearly a one-third reduction in funding to state and USAID, $10.1 billion, and an 18% reduction in overall funding for HHS, cuts of $15.1 billion. Within HHS, a 1/5 reduction in funding to NIH of $5.8 billion is proposed. The only U.S. agency in global health research and development to receive an increase in funding is the Department of Defense, which is proposed to receive a 9% or $54 billion boost. While the Global Fund is actually mentioned in the skinny budget and it seems positive, the clear statement of the limit currently in law could mean that the budget will be reviewing, that the Office of Management and Budget will be reviewing the replenishment numbers, i.e. the 12.9 raised during replenishment, and claim that they are prohibited from funding the Global Fund to meet the full $4.3 billion commitment. This is because there's a cap on U.S. contributions that it can't go beyond 33% of total contributions to the Global Fund. We will have to wait and see what the funding level is, as well as what their justification is for cuts after the full budget is finally released. So while the full budget will come out next week, there was a report in Foreign Policy about a leaked document for the full budget. The leaked document, funding for global health programs were cut by $6.8 billion. Sorry, we're cut by $1.7 billion, which is a 20% cut, and they would be funded at $6.8 billion as opposed to the $8.5 billion that they were funded at last year. This is the actual leaked document. USAID received cuts totaling over $1 billion. The arrow points to the Global Fund and UNAIDS, which were lumped together and cut by $270 million. PEPFAR also received a cut of $426 million. While this is alarming, this is still just a draft proposal, and the final request may differ. Again, while this is supposed to be the timeline for the budget process, because the president has not released his full budget, the 302A, or the allocation for total spending for all discretionary spending, has not yet been determined. This also means that the chairman in both the House and the Senate have not provided the 302Bs, which are the funding levels for various appropriation bills. This means that the appropriation subcommittees have not yet begun drafting their spending bills. Since the budget process is delayed, we still have time to advocate over the next several weeks and potentially months. The good news is Congress has the power of the purse. And Congress, both Democrats and Republicans, have had a very strong reaction against the president's skinny budget and the proposed cuts. However, there is still a lot of pressure to cut foreign assistance as the administration increases spending and defense. Part 2, this is advocacy and messaging for global health. Since you all are or were Global Health Corps Fellows, we know you are committed to social justice and view yourselves in some way a part of the health equity movement. So now it is time to dive deeper into why now, and how to advocate. Additionally, those who are attending the in-person training next week will build even further on this messaging and advocacy. So what is advocacy? Advocacy is the act of building support for an idea or cause. It's the deliberate process of influencing stakeholders and using your voice as a mode of power to inspire and mobilize. Lobbying is a specific type of direct advocacy, but advocacy more broadly is about inspiring and mobilizing, one of the Global Health Corps' 6 core leadership practices. So let's talk about how to advocate. First, you've got to know your audience, what their background is, what issues they support, and what issues they don't support. Secondly, speak from a place of authenticity with regards to your stories and what excites you and what's meaningful. Be clear on what exactly you want to say. Less is more. Finally, practice, and get feedback from others. It'll help you hone in on and stick to those key messages. That's a lot more powerful than rambling, and you have limited time and attention, so you want to deliver the most powerful, cogent, and compelling communications you can. Let's delve a little bit deeper into how to advocate and knowing your audience. I just want to underscore here how important it is to know who you're talking to. You won't be able to devise a powerful message to affect change otherwise. Those of you coming to DC will be sending you briefing packets on the members of Congress you'll be meeting. We will be looking at their voting record and other considerations. For example, if they have a military background, how would that help you shape your message? The why are you sharing your story piece is about understanding the power that you personally bring. For instance, are you a constituent? Are you someone who has been personally affected by a program or a policy? Secondly, sharing your story. It's important to excavate and cultivate your own story and share it purposefully in order to move others to action. The kind of story you share will be determined by the audience and ask, whether it's for funding, programs, or encouraging policies. For folks that are coming for the in-person, you should begin thinking about some stories that you would like to share for next week. So for the budget, this is our target audience, the budget decision makers. We're looking to reach the leaders of the appropriations committees in Congress, Chairman Frelinghuysen and Ranking Chair Lowy in the House, and Chairman Cochran and Ranking Chairman Leahy. We're also looking to leadership and members on the state foreign operations and related programs subcommittee leadership on the House and Senate appropriations subcommittees, because those are the ones that are in charge of the global health programs and international development programs. We will delve deeper into who they are during next week's in-person training. For those of you not coming, reaching the budget decision makers can be done in more ways than just meetings on the Hill with key players. You can write letters, call your congressman and senator's office to support the international affairs budget, global health programs, and the Global Fund. You can use social media, write op-eds, blog posts, Facebook posts about issues that matter to you. We will send around a toolkit that will allow you to participate even if you're not joining us in person on May 25th. We're coming out with a toolkit following the budget release next week, so I'll be sure to send that around. So let's talk about what our key messages are for global health funding advocacy. Our first message is to support maintaining level funding of the entire international affairs account and global health programs. Secondly, U.S. investments in global health helps expand economic growth and trade and strengthen U.S. security and diplomatic relations. The economic argument is that 11 of 15 of the top U.S. trading partners have been recipients of U.S. foreign aid. 95% of U.S. consumers live outside the U.S. border. Malaria-free countries have 5 times greater economic growth than countries with malaria. Every dollar invested in malaria control yields $40 in economic returns. Every dollar spent on tuberculosis generates $30 through improved health and increased productivity. The poorest 2/3 of the global population represent $5 trillion in purchasing power. And finally, 6 of the 13 fastest growing economies in the world are located in Africa. The global health security argument is that we've been reminded repeatedly by outbreaks such as Zika and Ebola that disease knows no borders. Containment, prevention, and evidence-based treatment of epidemics are national security matters that we cannot afford to underestimate or underfund. U.S. investments in disease programs like the Global Fund support strengthened health infrastructure to help prevent future deadly threats like Ebola and Zika from spreading. Finally, our diplomacy argument is that investing in global health is an essential part of U.S. diplomacy. It actually makes the rest of the world like us. A bipartisan analysis found that global health investments support American diplomacy by generating goodwill, accelerating development, and reducing social and political instability in countries with a heavy burden of infectious disease. According to surveys, public opinion regarding the U.S. improves in countries where the U.S. is giving development assistance. Finally, Africa, where PEPFAR and PMI investments have been concentrated, is the only region in the world where favorable opinions in the U.S. exceed the global average in every country surveyed. Global health investments make developing countries stronger, more stable, and more prosperous, which in turn paves the way for these countries to solve their own problems, share responsibility for regional and global security challenges, and participate as trading partners with the U.S. So what are our key advocacy messages for the Global Fund? The Global Fund is an effective, efficient model of global health financing. It's saved more than 20 million lives. It's a result-oriented and accountable financing mechanism, and it represents a new kind of funding approach that helps build on country ownership for the future. The Global Fund also supports the success of U.S. bilateral health programs, such as PEPFAR and PMI and USAID's TB programs. They reinforce each other's work across the globe, working hand in hand to avoid duplication, increase transparency and financial efficiency, and scale up innovative programs. Investing in global health in the Global Fund has economic and security benefits for America as well. Maintaining the U.S. commitment to the Global Fund alone could support at least $96.7 billion in economic gains in the coming years. Finally, the Global Fund leverages funds from other donors and implementing countries. One final note on the Global Fund and maintaining the $1.35 billion over FY18 is that the fifth replenishment, again, mobilized $12.9 billion for the next 3 years. This will enable Global Fund programs to save up to 14 million lives for a total of 30 to 32 million lives saved by 2020. It will also avert 194 million new infections and deliver $230 in economic gains. The projected impact, which is shown here, is of just the U.S. portion of the $4.3 billion pledge to the Global Fund is 5.7 million lives saved, 81.7 million new HIV, TB, and malaria infections averted, and $94.6 billion in economic gains. Finally, advocacy works, and our advocacy is to maintain the $1.35 billion for the Global Fund, maintain the level of funding for global health programs more generally, and maintain the international affairs budget overall. Thank you all for listening, and if you have any questions at all, please include them in the chat box to the right. So I just had a question about sending around a recording of the webinar, and we will actually be uploading it to YouTube, and anyone can view it at any time. So we'll be sending that around as soon as we end the webinar. Does anyone else have any questions about global health funding, the Global Fund, the U.S. budget and appropriations? Hi, Brian. So I just saw your question about the misappropriation of the Global Fund funds in Sub-Saharan Africa, or is it South Africa? I assume that it's South Africa, and that's not something, Sub-Saharan Africa, that's not something that would come up during the U.S. budget appropriations process. That would come up with the Global Fund Secretariat. And the Office of Inspector General there. So we'll just have a justification for the cuts. Does anyone else have any further questions? All right, well, thank you all for joining us today for the webinar, and we look forward to meeting with some of you next week. Thanks so much.